Hi everyone, welcome back to the channel. In today's video, we will go through coding guideline questions CPC 2025. If you found this helpful, please subscribe, like and share. So let's begin. First question. According to the application of cast and straping CPT guidelines, what is reported when an orthopedic provider performs initial fracture care treatment for a scaphoid fracture of the wrist, applies a short arm cast, and the patient will be returning for subsequent fracture care? A. 29075 modifier 22, B. 25622 29075, C. 25622, and D. 29075. Here in this scenario, orthopedic provider treats a scaphoid fracture of the wrist, performs initial fracture care, which means closed treatment, applies a short-term cast. Patient will return for subsequent fracture care. So first step, identify the procedures. 25622 is closed treatment of distal radius or ulnar fracture, which includes initial fracture care. 29075 means application of short-term cast. According to application of cast and strapping guidelines, first cast is included in the fracture or dislocation treatment code. No separate code is reported for the first cast applied by the treating physician. If a cast is removed by another provider, you could report a removal code. Okay. In this case, 25622 includes closed treatment and short-term cast application for scaphoid fracture. 29075 is not separately reported in this case. Let's analyze each options. In option A, 2907522, which is incorrect. Modifier 22 is only for increased procedure service, not routine initial fracture care. So it is incorrect. In option B, it is also incorrect. Cast application is included in 25622, so it should not be reported separately. In option C, it includes initial closed treatment of scaphoid fracture plus cast application. So it is the correct answer. In option D also incorrect. Alone this only codes cast application, not the fracture treatment. In simply, first cast is included in fracture care. Only subsequent or externally removed cast are reported separately. Understand? Next question. According to CPT medicine guidelines, which is not reported as imaging guidance? A. Magnet resonance imaging, B. Fluoroscopy, C. Radar signals, D. Computed tomography. Answer C. Radar signals. According to CPT coding guidelines, which scenario best represents modifier 24? Options. A. Patient is coming back to have stitches removed from his hand within the post-operative 10-day global period of the repair. B. Patient had hernia surgery 2 days ago and returns to the operating room to incise and drain a post-operative abscess. C. New patient is seen in the physician's office for effusion on the left knee. Physician examines the patient and performs a minor procedure. D. Patient had an appendectomy 2 weeks ago. Patient returns to see the physician who performed the appendectomy, complaining of a swollen foot. The swollen right foot providing an E&M service which is unrelated to the appendectomy within the 90-day post-operative period. So what is modifier 24? Modifier 24 is used for unrelated E&M services provided during the post-operative period of a procedure. Always remember, patient is within the post-operative period. E&M service is unrelated to the original surgery and same physician provides the services. Always remember these key points. Okay, so let's go for each option. Option A, stitches removal. It is wrong because removing stitches is directly related to the original procedure. Even though it happens in the post-operative period, it is a part of the global surgical package. So no modifier 24. It is wrong. Option B, incision and drainage of a post-operative abscess after hernia surgery. This is also wrong answer because this is complication of the original surgery. Treating complication does not use modifier 24. It is still related to original procedure. So it is also wrong. In option C, new patient with a knee effusion. This is also wrong because this is a new patient visit, not a follow-up of a previous surgery. Modified 24 only applies to established patient during post-operative period. So it is incorrect. Then option D. Swollen foot unrelated to appendectomy. It is correct answer because the patient is within the 90-day post-operative period, the E&M service. Here, swollen foot, which is unrelated to appendectomy. Same physician provides the service. So, here, modifier 24 is used. Always remember these key points when using modifier 24. Patient is within the post-operative period. E&M service is unrelated to original procedure. Service is provided by the same physician. Okay. Next question. A surgeon performs a percutaneous balloon angioplasty and atherectomy in the femoral or popliteal artery. According to the endovascular revascularization CPT guidelines, what is reported? Options A 37225, B 37227, C 37224, 37225, D 37224. In this scenario, if angioplasty and atherectomy are done at the same arterial segment, report only the atherectomy because angioplasty is included in the atherectomy code. So, don't code separately. Report only atherectomy. Okay. Here, 37224 is balloon angioplasty and 37225 is atherectomy. So here we need to code only atherectomy 37225. Here option A 37225 is correct answer. According to ICD-10 CM coding guidelines, which medical condition does not have a causal relationship with hypertension? Option A chronic kidney disease, B congestive heart failure, C heart disease, D acute kidney failure. Option D acute kidney failure is right answer. Others are related with hypertension. If you have any doubts in any of the today's topic, comment below. I will make sure to clear it for you. So this is all for today. If you found this helpful, please subscribe.